Hi, this is Dan Clifford with this week's Amada Minute. This week, we want to talk about hospital readmissions and the number one cause of that being heart disease. On this graph, you can see that for cardiovascular disease and for heart failure, those are two of the main reasons for readmission to the hospital, respectively. When you look at some of those, how they present, you can break it down to CHF patients are over 20%, dysrhythmia patients are over 20%, heart attacks are over 20%, and chest pain is over 20%. So even individually, those are over 20% readmissions within 30 days of the hospital. This next one shows that if you're looking at heart disease, which is this middle part of the graph, and you have a Medicare patient, Medicare patients with heart disease will be readmitted 23% of the time. Right below it is Medicaid, and those Medicaid patients with heart disease will be readmitted 28% of the time. So not only is it the number one cause of readmission, but you can really even break it down to payer of who's going to be readmitted into the hospital. And now this last graph that I came across, I really found interesting. This middle line here is for heart failure patients, and that purple spike is for the patient type that's called willful endurers. Your willful endurers are your tough cookies. They're the people that have been around, they've seen it all, they're a tough cookie, they're not going to let this take them down, and they really can't be bothered with these issues, right? Your tough cookie patients, over 50% are going to be readmitted back into the hospital within 30 days. So if you have a tough cookie patient that's got heart disease and Medicare, that's what to avoid having patients be readmitted. This is where Amada can help. We can have a caregiver in the home and help decrease that risk of readmittance into the hospital within 30 days. And that's this week's Amada Minute.